So then what we do is often we combine that with this strategy, which is called the 1-2-4 all. So this is another liberating structure. So that 15% solution can just be more of a concept than an actual tool per se. You can just invite them to think of what do they have control over. You may complain about how much traffic there is when you're driving into work. Well, you have control over some of that. Leave earlier, ride a bike, hire a helicopter, I don't know. But I mean, you've got things that you could potentially do that could make that better rather than just focusing on what you can't control. 1-2-4 all is a very simple technique. Anybody have any other challenge that they're working on we can use for a 1-2-4 all exercise?
Using stuff.
Okay.
Trying to get rid of it.
Trying to get rid of the clutter in the operating theater, that kind of idea. Okay. So.
And we don't have enough storage.
And you don't have enough storage.
Or office space.
Right. So those are kind of the 85% that you can't control, right? You're not going to go and build new operating theaters. That's not on the that isn't possible. But what can you do with what you have to make that better? So let's say you were a group of staff working in that area. You've said this is something we need to work on. This is how you can engage them to work on it. So a 1-2-4 all sounds really simple, but it's hard for people to do. We give you 1 or 2 minutes to think on your own. What are 1 or 2 solutions that I could come up with to make this problem better? And the key thing is on their own, so they're not talking to anybody else. After a minute or two, you say, turn to the person beside you, like we did with speed networking, and have a 2 to 3 minute conversation between the two of you on your mutual ideas. They may be similar, they may be different, I have no idea. Then, after 2 or 3 minutes, that group of 2 finds another group of 2, and the 4 of you have a conversation about your ideas. And then each group of 4, depending how big the room is, each group of 4 reports back. That's 1-2-4 all. I have used this approach in a number of places. I'll tell you one little story and then we'll actually do it. We were working in a little hospital in northern Nova Scotia, where we were from the big bad city. We came in and we were trying to chat with frontline staff and they were all just staring at us like we had 2 heads. Because we asked them a question, it was a group of nursing managers. We asked them a question, they all just stared at us. And the question was around, do you feel the organization is doing enough to control C. difficile? Do you feel like things have been done, that we're moving ahead and we're going in the right direction? And they just stared at us. We said, okay, this isn't working. So then we said, okay, why don't you take a moment to think of a couple points that you think are important to bring up about this, good or bad, and then turn to the person beside you, and then that group of 2 meets another group of 2. They talked for an hour. It was unbelievable, the difference between me just canvassing you versus me getting you to speak to each other. So let's take this idea then. The idea is we've got too much clutter in our operating theaters, which I'm sure is probably pretty universal unless you've got a brand new facility. People bring their lunch in there. They've got the anesthesiologists have their briefcases in there. There's all sorts of junk lying around. If you've got a patient who subsequently you found out had something terrible, you got to throw all those supplies out, right? It's actually a pretty big deal. So what are your ideas on how to make that better? Now, some of you may or may not work in that environment. It doesn't matter. The idea of these approaches is you want to engage everybody to hear what they have to say. So take a minute to think of 1 or 2 ideas on how you would decrease operating theater clutter. And then I'm going to ask you to turn to the person beside you, share those ideas, and then maybe for the ease of this, we'll just have tables chat, okay? So not the 4, but maybe 6 or 5 or whatever. And if there's an odd number, I won't get upset if it's like a 3 of you chatting, okay? I won't force one of you out. Okay, so go ahead, take a minute where you're just thinking about how to decrease operating room clutter. No talking. Maybe you have experience with it. Maybe you've seen something that you liked. So turn to a person beside you and have a short conversation about some of the ideas that you've got. Okay, if you haven't yet, now speak amongst your tables. So, I'm curious, maybe we'll just go around table to table here, what some of the ideas were. Maybe we'll start over here with you guys. Anything? One of you. Yeah, so actually come in with using Triz and starting a whole new way. Okay. Okay. Did any of you have similar ideas that you heard somebody else say something that was quite similar? So because that's often kind of helpful, because then you hear another idea which is like yours, you start to build on each other, and you realize that you're both kind of leading in a certain direction, which can be kind of supporting in a way with what you're doing. All right, so a lot of really good ideas. You can imagine if you were doing this with a group of staff who actually work in that setting. So you're in your hospital and you're going in and you're doing that exercise with them, perhaps starting with a Triz. How do we make this so cluttered that you can't move around? How would you do that? Which of these things can you take ownership for? That idea of that sort of 15% solution. You could actually make a difference on this. And then do a 1, 2, 4 all, where you're thinking individually and then pairing and then going to the 4. It's very specific, that 1, 2, 4 structure, or in this case 1, 2, 6 or whatever it was. How often in healthcare are you given the opportunity to stop and think? Never, right? We just see it and you just go off and fix it. And how often are you forced to engage other people? So, for example, one of you may have a brilliant idea on how to decrease clutter in the operating room, but that's your idea. That's not their idea. They may have different ideas, and they're the ones touching the problem. They're the ones that are actually working there. That was the biggest mistake I made for the first half of my career. I'm so smart, I have all these great ideas, I'm going to come in and tell you what to do, and you're going to ignore me. And one of the comments would be, you don't do my job. You know, basically the nerve, you coming in and telling me what to do when you don't do my job. So that's a combination of stringing several liberating structures together all at once. And you can imagine if I just would have asked the question, how do you decrease operating theater clutter? 1 or 2 of you might have put your hands up. Might have had an idea, but you wouldn't have had this mixing of ideas and hearing from every single person in the room. And if we had invited housekeeping staff, they own a piece of that, for sure. And the nurses own a piece of it. And the surgeons own a piece of it. Everybody there, the anesthesiologist, everybody there owns a piece of that problem. And if you engage all of them and you're getting them to interact with each other, it is really remarkable what comes out of that. You keep doing that, a way forward starts to emerge. And then that will work for you. And then you can publish a paper on how you dramatically decrease clutter by 90% in your organization, and it's all awesome. And somebody else will pick up that paper and try to do exactly what you did, and it'll fail. Because it's not the what you did, it's the how you got there that matters. And that's the piece that we never publish on. All right.
So I just ask,
yeah.
Going to vaccines, the campaigns we run are always quite difficult, and trying to get numbers up. How would that work? Would it be a way forward to
Yeah.
try and do it
With these concepts? So I'm thinking specifically flu shots, for example, is something that every organization struggles with, how to increase vaccination levels. Yeah, I think that the way that I would approach it would be exactly the same way. These tools are kind of universal, and so you could easily engage a group of frontline staff and ask them, how do we ensure that none of you ever get vaccinated? And there'll be a whole bunch of ways that they could ensure they'll never get vaccinated, right? Surf the internet and find out they're all going to get Guillain-Barré syndrome. Flu shots give you the flu. I've got other colleagues who told me that they got the flu shot and their arm fell off last year, and it goes on and on and on and on and on. All the reasons why they're not going to get vaccinated. We can never get the vaccine because it's not available to us. We have to go during certain hours. It goes on and on. You could then imagine engaging people to say, okay, well, some of you do get vaccinated. So what is it that gets you vaccinated? What are the reasons why you get vaccinated? Why don't you sit and think for a minute why you get it done? Share it with the person beside you, and then the four of you chat. What you're trying to get is peer-to-peer spread of ideas. If I show up and say, you have to get your flu shot, the more that I do this, the more you will tell me it'll be a cold day in hell before I get my flu shot, right? That's the way people work. The more you push them, the more they push back. But if you're influenced by your peers, for good or bad, you are much more likely to actually go in a certain direction. There's a wonderful article that was in the New York Times a few years ago called "Your Friends Are Making You Fat." And it's all the study of social networks and how they've shown that obesity, that one of the best markers for obesity is the lifestyles of your friends and your friends' friends and your friends' friends' friends. So even 3 degrees of separation will have influence on your own behavior. For good or bad. And so we're really trying to tap into those social networks that as much as possible, you're learning and influencing each other rather than me doing it. Because I'm just the guy. I'm the guy who you expect to talk about flu shots are good for you, and everybody's going to basically tune me out. But if your neighbor talks to you about it, it'll be more powerful.
Because there is a school of thought that if you've got clinical data, put the numbers up. And I think it helps, but it doesn't actually put them up maybe as high as they should.
Yeah. I mean, I would say I personally have no idea how to improve vaccination rates. I have some ideas in my head, but I don't know. But the way I would find out would be engaging the groups that I'm trying to vaccinate. So in our hospital, for example, we dramatically improved vaccination rates last year because one of our frontline staff came up with an idea that really resonated with people, which was a shot for a shot. So if we vaccinate you, we will donate 1 vaccine to UNICEF in Africa. And people loved that idea. Like that, they could really get behind that. They couldn't get behind, if you don't get a flu shot, you're going to kill your patient. They're like, yeah, whatever. Which is frustrating for people, right? Because they believe that that's an important thing to do. But remember that slide I showed with what motivates you doesn't motivate them? It doesn't matter what you believe, it's what they believe. And so tapping those ideas, engaging people using some of these techniques, you may have ideas to start to float to the surface that a lot of people like. And then that's the route you take. So yeah, you could definitely use these approaches. When I've done this work, usually I'm working with about 1 to 2% of the staff. So we could say, hey people, there's a meeting on flu vaccine tomorrow at 9. And 4 people show up out of 200 people. You start with those 4. They had some reason why they wanted to show up. I don't know what it is. Maybe it's to yell at me because they hate flu shots. I don't know, but they've showed up. So I'll start working with them. And the key thing about this is by you working with them and them getting their ideas forward, they're going out and influencing other people. You're out of the equation. And so you don't need to have the whole group there. Any session that I give, it's never mandatory. I only want to work with the people who want to work with me. So I don't force anybody to show up. It's only the ones that want to be there. So with these end-of-life sessions that we've had at our hospital, for example, we have 16,000 employees in our hospital. It's a big place. We invited every one of them to end-of-life care discussions. Everybody, didn't care what their job title was. They could have been working in the deepest, darkest recesses of the facilities plant or finance or whatever. Didn't matter. We invited all of them. And for each session, about 150 people showed up. Why they showed up was deeply personal, right? You could have somebody from finance who shows up. Clearly, End-of-life care, I mean, it is a financial concern if people are kept alive and they didn't want to be kept alive. I mean, you can make that argument, but they're there because usually they experience something personally. Family member, a friend, somebody either had a wonderful end-of-life experience or a horrible, often the latter, horrible end-of-life care experience, and they wanted to be there because they wanted to say something. So whoever showed up, showed up. We engaged them using all of these techniques. How do we ensure that all of our patients die alone and in pain? It's a pretty brutal question. What are all the things that we can do to make sure that that happens? And when you went through that list, you could hear a pin drop in the room, because every single one of them, to some degree, we were doing. And then it's, okay, are there things on this list that we could start to chip away at to make this a little bit better? Then we did 1, 2, 4 alls, and as you do that, a few ideas start to float to the surface of a way forward. So I walk into there as an infectious disease doctor. I have no clue how to improve end-of-life care, but I don't need to. These are the people that are working with the patients, and as we engage them, a few simple ideas, the minimum specifications, start to float to the surface. Nobody should die alone. Okay, what does that look like in your practice? If you're a housekeeper, what does that mean to you? Nobody should die in pain, either physical, spiritual, emotional, whatever that means. The patient has to be in the center of these discussions. So how do we get everybody in our organization to see how they can obey those simple rules, those simple things that emerged in their own practice? So it may be that I'm terrified of having end-of-life care conversations with patients, but it may be that at least I now know how important this is because I've been engaged, and maybe I'll ask palliative care to see them. That's my way of obeying those things. As a housekeeper, maybe I will continue to go in the room when someone is dying unless I find out otherwise that I shouldn't be there, because maybe they want that personal contact. I don't know. Maybe I have an important role to play. And so it's through the engagement that the way forward becomes clear. You don't necessarily have to have an automatic path where you know where you're going. And most people don't show up, and they don't need to. That's the hard part. You keep thinking you need everybody there, and you don't. You just need some people that care, and then it moves forward. We did all those changes, and that American hospital that I mentioned with the hand washing, that was done with about 3 staff on a nursing unit. They, for whatever reason, thought hand washing was important. They became self-proclaimed champions. I didn't use that language because then we're punishing them when we give them a button. So they wanted to work on this. They influenced their other staff. They got the things up. They would chat it up. They could see with their own eyes that their idea, someone listened to them and they actually did something that they asked them to do. It's amazing. But it all came from them. That's the thing. Any other questions or comments?